The specificity of antibodies is such that we can utilize antibodies taken from, as I said, rats, mice, um, rabbits, horses, goats, and we can use those as a diagnostic tool. We can test for, the presence, or not only the presence of antibodies in a patient. If you have antibodies, that means you were exposed at some point in time to an infectious agent, but we can test titers. What concentration? If it's a low concentration, either it was a very minimal exposure or the exposure was in the past. High concentration means you got really sick from it, or it was, maybe a mild illness, but it was very recent. So we can use that as a means of judging where you're at in your disease progression. Serotyping is another thing we do. Remember I said E. coli, some of the E. coli strains, some are, when it comes to being pathogenic, where others are highly virulent, highly kid-damaging, deadly. The 0157H7, the 015, the 7. These are different serotypes. Different collections of serum from patients react differently to different ones of these strains. So we went through and we grouped them like with like, and we numbered them. So that way we know if somebody gets an E. coli infection that's causing them diarrhea and we test it and it's, it's a serotype that's been shown to be somewhat benign, well, that means this diarrhea will pass. Some, antibiotics, yes. Tell them to drink lots of fluid. Maybe eat some yogurt, probiotics, good to go. Do the serotyping and it turns out, this is 0157H7. What's just general diarrhea now? Within a day or two is going to start becoming bloody diarrhea as they slough off the lining of their large intestine. And they suddenly become bacteremic and they got bacteria in the blood and it's going to kill them. Serotyping allows us to know exactly who's causing the disease, and that will help us determine best possible treatments. Another thing we can do is what's referred to as Western blotting. We take all the proteins that are present in a microbe, a bacteria, a virus, and then we separate them out in an electric field in a gel. And then we apply those proteins from the gel onto a piece of paper. We expose that paper to the patient's serum. The different proteins have now been separated out by size, and they're now on the paper. So we can go through and we can look at which of these proteins the serum antibodies of that patient respond to. This was, for a long time there, how they determined whether or not somebody was HIV positive. Separate out the proteins of the HIV virus, put them on paper of some sort on the substrate, expose that to patient serum, and then you come in with another antibody to human antibodies. We do this a lot of time. The antibodies to human, those are from goat, horse, mouse, rat, whatever. We can get a lot of those. Whereas the HIV antibodies that the patient may have are going to be in very low antibody titers. Go through and you can see the banding pattern. Hey, look, somebody we think may have HIV, but they're not making antibodies to HIV, so they're not HIV positive as of yet. Oh, look, this other patient, they have this banding pattern. You can see to the far left there, it looks like, almost a fuzzy barcode. Each of the different lines is a different protein from a virus, a bacteria, whatever, that were separated out using electrical fields and then applied to paper, and a patient's serum was exposed. So you can go through and look at the banding pattern to see, well, yes or no, was the patient ever exposed? And two, which proteins are they making antibodies to? Turns out not all patients are going to make antibodies to the same proteins, to the same parts, same amino acid sequence to a protein and things like that. So it also gives you an idea. It's all, not only is it diagnostic, but it gives you an idea of just how well functioning that patient's immune system is. And then we can also just, take a microbe, one that's going to be hard to culture in the lab, one that's going to take too long to culture. Well, we take that microbe. Here, example is the syphilis, Treponema pallidum, syphilis bacteria. It's hard to grow in the lab. It takes time. So what we've done is we've taken the bacteria, we've injected it under the skin or in the bloodstream of rabbits. Okay? Nobody cares if you screw up rabbits or mice, whatever. We bleed them, take all the serum, and then we isolate the antibodies that were made just for Treponema pallidum, syphilis. All the other antibodies we get rid of. So now what we have is this concentrated antibody solution that is specific just for syphilis. Patient comes in, not sure if they have syphilis or not. So you're going to either swab the urethra or they have one of the sores, the cankers that are associated with, secondary, tertiary syphilis infection. You go, you scrape, you swab, you smear it on a glass slide, and then you take that rabbit serum, put a drop of it where you smeared the syphilis, rinse that away, come with, if you did it with rabbit, then you come in with goats that have been injected with rabbit antibodies. Well, on the goat, though, the goat serum, all the antibodies have been tagged with a molecule that glows in under black light. So, on the slide smeared the sample from the patient, put a drop of the rabbit serum that's just for Treponema, rinse that off, come in with a goat. If the rabbit antibodies for syphilis were able to stick to anything, the goat will stick to the rabbit, and then when you look under the microscope, you will see exactly what they're showing there in that microscope picture. Little squiggles that glow green because the rabbit bound to the syphilis, the goat bound to the rabbit. There you go. Some tests, to even make it quicker, they'll take the concentrated rabbit serum, and they'll tag each of those individual antibodies with their own little glow-in-the-dark molecule. There's upsides, downsides for both. It all depends on what you're wanting to do and how quickly you want to do the test.